Malignant pleural mesothelioma, or MPM, is a rare form of cancer that affects the lining in your lungs. For over 15 years, there were no new treatment options for patients with MPM until new technology assisted in the development of Optune Lua, a wearable device used along with chemotherapy. So here to tell us more is Dr. Raj Mehta. Hi, Dr. Raj. Thank you so much for being here.
Privilege and honor. Thank you.
No problem. Now tell me, what is MPM and what are some of the common symptoms we could look for?
So MPM, as you alluded to, is malignant pleural mesothelioma. So it's a rare type of lung cancer. Approximately 2,500 people in the United States are diagnosed with MPM every year. It's closely associated with past exposure to asbestos. At least 90% of all mesothelioma cases were as a result of asbestos exposure. Some of the risk factors, we talked about asbestos. In terms of symptoms, we're talking about shortness of breath, chest pain, cough. It can mimic a lot of other conditions. And these are the things you can kind of look out for. But I think along with the risk factor history, these are the things we can then bring up with our respective healthcare provider.
Now, let's talk about the technology behind this new Optune Lua, I believe, if I'm not saying that right. Please correct me. What is it and what are some of the side effects?
You said that perfectly right. It's called Optune Lua, and essentially Optune Lua is a wearable device that is used with chemotherapy to treat unresectable, locally advanced, or metastatic MPM. So what Optune Lua does is that it actually produces electrical fields called tumor treating fields. And these fields in and of themselves disrupt cancer cell division, potentially causing cancerous cells to die. In a clinical study, so Optune Lua was used in addition to chemotherapy, right, and demonstrated a favorable overall survival of 18.2 months. In terms of side effects, the only device-related adverse event was skin irritation, mild to moderate in about 66%, and severe in about 5%. But essentially, this wearable device can be used, can be carried, sleeping, driving, traveling, and is something that can be integrated into the daily routine of a patient's life.
Man, we love technology here on Good Day Live. It's always evolving, and especially the sides that help, our medical field and help us get to where we need to be and make all of these advances.
Yeah, I know. I think that anything exciting, something new, especially in the field of mesothelioma, specifically in MPM, which obviously is associated with a lot of, in a sense, morbidity. And so when we're employing a new electrical field treatment that is actually now FDA approved through the humanitarian device exemption pathway, it's exciting. And especially given the favorable risk side effect profile, it's something that can add value.
Yeah, no, what should people out there know if they or a loved one of theirs is diagnosed with MPM?
Finding out that you or a loved one has malignant pleural mesothelioma can be overwhelming. All of a sudden, you're facing unfamiliar challenges, existential crisis, and need to make important treatment decisions fast. So I think learning about your options can be a good place to start. Where can you do that? Be sure to talk to your doctor, first of all, whoever you're with, to find out exactly what these options are. Another great site where viewers can go for more information is called learnaboutmeso.com. And that's just great because before we talk about treatment, we really got to be empowered to deal with mesothelioma and then make sure that we take care of ourselves. So learnaboutmeso.com. And again, my name is Dr. Raj Mehta from radiation oncologist at Genesis Care.
Thank you so much for being here and speaking on this important topic. We really appreciate you.
Absolutely. It's a privilege and honor, and thank you for having me.
No problem. Everyone, I want you to stay right there because we got more Good Day Live when we get back.